viewers. You are welcome to another edition of Health Talk Show, coming to you from the studios of Fulltimebuzz TV. We are live on Facebook, we are live on YouTube, we are live on Instagram. So just tell a friend to tell a friend to tell another friend to join us because, as I said, caring is sharing. In sharing, we care about each other. My name is Beatrice, your host on this show. And today we are going to talk about oral and dental health. So I ask you, when last did you visit your dentist? How well do you take care of your health orally or your oral health? We have with us a renowned dental personnel all the way from UK, Pastor Mrs. Jennifer Owusu-Ansah. Welcome, Madam Jennifer.
Oh, thank you. Thank you so much.
We thank you for making time to join us today. Before we set the ball rolling, can you please tell about yourself?
Oh, okay. As you introduced me, my name is Pastor Mrs. Jennifer Owusu-Ansah. I've been in the dental care profession for over 12 years now, and it's quite good. And yeah, I love my work. Also, I've been in the ministry for a while as well, and yeah, so I'm enjoying Christ Jesus and also working as well. I'm a working mother, and yeah, I'm enjoying. So we give God the praise for everything that He has done. In the name of Jesus. Amen. Amen.
Amen. Amen. Thank you very much. So let's just start the ball rolling. Please tell us what is oral health or what is dental health? What do we need to know?
Okay. We're going to go down to a very simple English for even our mothers to understand. When we talk of oral health, it's basically your mouth, everything that is in your mouth, as big or as small as the mouth is. There is so much entails in the mouth. You've got your gums in your mouth, you've got your teeth, you've got your tongue, you've got palates in your mouth, you've got a lot of things going. But basically, the way the Lord made us is to have your teeth all the days of your life. Your teeth should last you all the days of your life. But because of our abuse, because of the things we do not have it for a long time. Some people lose their teeth very young age, especially the Western world. So talking about oral health is about talking about your mouth and everything in your mouth.
People lose their teeth as an early age. So how well should we take care of our health? Or like how well should we take care of our teeth or our mouth so that we don't lose our teeth?
Yeah, thank you. Thank you. Basically, looking after your teeth is very important. It's very important for you to look after your teeth. The basics you can give yourself is to brush twice a day, and also to use a mouthwash and to use medium-headed toothbrush. I remember in Ghana, back in the days, we used to use hard toothbrush to brush. Brushing hard doesn't necessarily mean you are brushing well, because when you brush hard, you basically brushing off your enamel, which I'm going to go into deep later on. I will explain what enamel is, what everything the tooth has. So brushing hard doesn't mean necessarily that you're brushing well, but you have to brush minimum twice a day. And also, you use mouthwash in a different time to toothbrushing. And another thing that is very important is brushing with a toothpaste. And the toothpaste has to be a fluoride toothpaste, because I'm actually standing on the basis of British Dental Council. In British Dental Council, we believe in brushing with fluoride. Brushing with fluoride. So every toothpaste you buy, you have to make sure the toothpaste have got sodium fluoride in the toothpaste. Every toothpaste you buy, look at the ingredients and make sure it's got sodium fluoride in the toothpaste. So you brush twice a day. That is the basics. And use fluoride mouthwash. Use fluoride mouthwash. Different time to your brushing. There is this theory that people do that as soon as they finish brushing, they will use a mouthwash. No, you shouldn't do that. Because when you use a mouthwash after brushing, you're basically washing away all the good things in the toothpaste. So use a mouthwash in a different time. So what is the good time to use a mouthwash? The good time to use a mouthwash is when you have finished eating. You know, when you finish eating, basically, in everyone's mouth, you've got your good bacteria. They are not harmful if they haven't got acid with them, if sugar hasn't gone into your mouth. As our human body work, that we all have good bacteria which fight the bad bacteria when they come. So in your mouth, whether you like it or not, it's a general thing that you have the good bacteria in your mouth. But they become harmful when they meet with sugar. When the good bacteria meet sugar, then they become harmful. Then they start destroying the teeth. So the good way and the basic that you need is to brush twice a day. Use a fluoride mouthwash and also use something to clean in between your teeth. I don't know whether you'll be able to see, but I just brought something that we use in the UK that you can use to clean in between your teeth. You can use this to floss in between your teeth. But everywhere in the world that you are, there is something called floss that you can use. I know back home we used to use toothpick to remove particles from our teeth, which is really bad for the gums, which is really bad for the teeth. But the best thing you can use is a floss. It's a floss. It's a floss. Use a floss in between your teeth after eating, or even normally the best time to do it is just before bed. Just before bed. During your brushing before bed, you floss in between your teeth. Remove every bacteria. Brush really well before you go to bed, and you can have your teeth for lifetime. And also, eating less sugar. Eating less sugar, anything concerning sugar, because sugar will destroy your teeth. That is the basics. Thank you.
Thank you very much. Thank you. That was awesome. So, in fact, you have really given me 1 point this morning, because normally, for example, I used to have immediately after brushing, I use mouthwash, thinking I was doing the right thing. So I have to use the mouthwash immediately after eating, not after brushing. All right. Thank you very much. So let me just ask this question also. So what are the symptoms of dental and oral problems? If like someone is having any dental issue, what symptoms will the person encounter?
Okay. I will come to the symptoms later, but I want to give a small knowledge of even what a tooth is. What a tooth is at all. What is a tooth? I don't know whether you'll be able to see this properly, but that is the inside of your tooth. So in a tooth, in a basic tooth, you have what we call enamel, which is the outer layer of your tooth. You know, the white bit that we can see, the white bit. When you open your mouth, what you see in the mirror is called the enamel. That is the harder part of your teeth. Okay, and inside of that, there is something called dentine inside the tooth. There is something called dentine inside the tooth. And also, inside the dentine, there is a flesh part called pulp. Pulp also in the tooth. So you've got all these three things in the tooth. So the path goes straight inside, getting to the roots of your teeth. So the basic symptoms that you can have, like some people say, I have toothache. In Ghana, some people will call it kaka. And there are so many, and there are various types. There are various types of toothache. And some of the symptoms that toothache, you cannot, the people who come to the surgery for pain says, oh, there is nothing like toothpaste. Some of them say it's even painful than childbirth. So I could imagine, but I've never experienced it. And also, the basic symptoms that you can get is like your mouth will be aching, your tooth will be aching, and not all that is something that you have to remove your teeth, because back home in Ghana, what they were doing is they would just take the tooth out as soon as it's hurting. It's because the problem wasn't caught earlier. Over here in the UK, the General Dental Council advised that at least as a person, especially children, visit the dentist twice in a year. That you visit the dentist twice in a year regularly so that we can take x-rays. And x-rays are taken every 2 years to check. We check your gums as well as your teeth to check what is going on in the mouth at all. And even with the x-ray, the tooth is 3D and the x-ray is 2D. So we don't even get to get everything 100%, because in the health sector, nothing is guaranteed. Nothing is 100%. We are only human and we are trying our best to help. So at the end of the day, the basic symptoms that we have that you can get is you get toothache. What will cause a toothache at all? I would say in basic, simple English that is sugar and not brushing well. So two things will give you toothache. Not brushing well. Some people are brushing, but not well enough. Not brushing well, or eating too much sugar, or eating too much citrus fruit. Like fruits, for instance. Fruits are good for you, but there are some fruits that are citrus, that have acid, that you don't need too much of it. I would say everything in a moderation. Everything in a moderation. And in everything, you don't do it every single day. You give yourself a break. You give yourself a break. Like things like eating orange, eating apple, and they are good for the body. They are good, but you don't eat it every single day. You give yourself a break, because when acid that is in the orange, acid that is in the apple, in the juices. With juices, there are so much sugar and there is acid as well. Fizzy drinks is very dangerous for your teeth, because they've got high sugar and they've got acid too. So when they come into contact with this enamel that I said, it will start to destroy the enamel. And also, there is something called gum disease. A healthy gum is very pink, but unhealthy gum is red. So if you don't floss in between your teeth, and if you are not brushing when you brush your teeth as well as your gum. If you are not brushing your gums very well, then it can cause you gum problems. But I've seen that most people in our skin color have problems with gums more than tooth decay, because most of us don't really like sugar, but our problem is our cleaning. Our problem is our method of cleaning. How well do you clean? You have to at least clean for 2 to 3 minutes. How long is your brushing? Brush your teeth as well as your gum, and stay away from gum problem or tooth decay. We will come into details later as we go on. Thank you.
Thank you very much. So I would like to acknowledge some of our viewers and their comments so that you deal with them first, then we go on to the next segment. Okay, so thank you very much, Brother Jinyami Ochiri. Thank you for staying tuned, Sister Grace Antiedu, Sister Patricia, Sister Stephanie, Sister Elena Johnson, Brother Samuel. Thank you all for joining in. So first of all, I'll give this first. We said what? Brushing hard doesn't mean brushing well. Yes, Brother Jinyami, that's true. And then Sister Grace said, why do people lose their teeth early despite brushing twice a day and using mouthwash? What causes tooth decay and gum issues? So she has two questions here. The first one says, why do people lose their teeth early despite brushing twice a day and using mouthwash?
Thank you. People only lose their teeth early when they have gum problem. The reason why you can lose your teeth is having gum problems. So gum problems causes you to lose your teeth. So the reason why, if someone brushes twice a day and loses their teeth, that means they are not flossing in between. As I said earlier, not only brushing, you have to floss in between your teeth, because what happens is food particles goes in between the teeth. And when the debris of your food, Sister Beatrice, as I said, when you finish eating and you use your mouthwash, you will see how much that will come out of your mouth after eating. Straight after eating, when you use the mouthwash, you will see how much food particles that is in your mouth. So brushing twice a day is not only the end of the story. You have to use interdental brushes, floss, or anything in between to clean. But please don't use toothpick. Use floss. There is something called interdental brushes. Use that one too. Anything that can brush in between your teeth, because looking after the gums is a different problem from brushing your teeth. So when you brush twice, you can lose your teeth if you don't look after your gums. How do you look after your gums? The way to look after your gums is to floss in between your teeth. Floss and use the mouthwash after eating, because food debris go in between your teeth. And when they go in, as I said earlier, there is good bacteria in the mouth. So the good bacteria will come together to mix with the food particles. And now they will start working together to destroy these gums. So, when you brush and you see bleeding, meaning your gums are not happy. When you see bleeding in the mouth, it means it's the first sign of a gum disease. So you can only lose your teeth when you have gum problem. Thank you.
Tooth decay and gum issues, and I think you've answered part of that question. What causes
tooth? So the tooth decay, what causes tooth decay? Okay, as I said earlier, with the enamel, enamel is very strong. Even scientists said is the strongest thing in the body. Our whole body, the strongest thing is the teeth. That's what scientists say. So this enamel can only be destroyed by sugar. Eating sugar and too much of it. I haven't said you shouldn't eat sugar, but eat it in a moderation. Eat it in a moderation, because whenever you eat sugar, the enamel have something that is attack that goes on the teeth. They have attack every time. So imagine that some people sip on a drink. They will be sipping throughout all the day. How many times would your teeth have an attack? It will have an attack so many times. But when you keep, let's say, drinks to meal time, and in between drink water. The best drink to drink in this planet is water. It's both for your general health and for your oral health, your dental health too. So in between, drink water. If you want to have a juice or even fizzy drinks, have it with meal time and not every day, because fizzy drink is very dangerous for your dental health. So stick fizzy drinks into a moderation. So fizzy drinks is one of the factors that cause tooth decay, because when the acid and the sugar in the fizzy get into the mouth, they go into contact in the mouth good bacteria. They start forming acid to destroy the teeth. So they will destroy it, and it will start gradual, and it will continue until it become a decay. So when it become a decay, then it started changing color. You will see that side has changed. That is a decay. And also with the gums, I forgot to mention something. If you don't brush well, there is something that is called calculus or tartar in the mouth that you will see some people, especially the inside of their mouth, they will have something hard. Then it cannot be removed. It cannot be removed by brush anymore. That is inadequate brushing, because it's called plaque to begin with. But when you leave it there and it hasn't been brushed for a while, it becomes harder. The only thing you can use to remove is a dental instrument. It's a dental instrument. Thank you.
Thank you very much. Thank you very much. That was so elaborate. So, Sister Patricia said, toothbrush at least must be used 3 months. After that, you need to dispose and get another one. But how true is this idea that toothbrush at least every 3 months you must change it?
Okay, thank you. The thing is, toothbrush, it's not really 3 months, it's 3 to 6 months. But then you can even dispose of it earlier than that, because it depends how worn it is. Is it still good enough for you? Do you brush? Is it helping you to brush well? So you have to brush your teeth as well as the gums, and as well as the tongue as well. So if the brush is good enough to brush the teeth and brush the tongue, then it's between 3 to 6 months. It's not exactly 3 months to throw them away. It's between 3 to 6 months. But if it's worn away, let's say within a month, then you have to just let it go, buy a new one, so that you can look after your teeth very well. Thank you. Hello. I think we're having a sound problem. I couldn't hear you over there.
Okay, one of my viewers is asking if she sees that there is a swollen gum around the molar tooth, what should she do?
Okay, thank you. If you see the swollen gum, then it's very dangerous. You have to see the dentist straight away. And the basic treatment that you can have is antibiotics. But don't start self-medication, please. The best thing that you go to the dentist. Sometimes when someone comes with swollen gum, we try to cut it, to drain it, because the worst things that can happen to a person, that you have a swollen gum and it goes through your throat. When your throat gets swollen and you cannot breathe, you will die. People don't know that dental health is so important, that if you don't look after your mouth very well, that can kill too. Because if you have a swollen gum and it goes to the throat and all your throat gets swollen, you won't be able to breathe. You can't get air in, so that can kill you. So it's very dangerous to have a swollen gum. When you have a swollen gum, the best treatment, you come to surgery, we will cut it and drain all the pus, because then the bacteria has formed this, and we have to cut it to drain it out. We know when it pop out, the person feels better instantly, and then we give them antibiotics to heal. Then later on, we take x-rays to check what is going on. Maybe whatever that is going on has progressed to the pap, has progressed from the dentine, from the enamel, dentine, and to the pap. When it gets to that side, then we have to, when it gets to the pap, that is when it comes to the gum. It starts from the dentine, from the enamel. It goes to the dentine, it gets to the pap, then it comes to the gum. So whenever it comes to the gum, that means it has reached a danger position. So you have to see a dentist. Thank you.
Thank you very much. So the next question says, Brother Junior says, what gives bad breath even though you brush twice a day? There are some people, they brush twice daily, and yes, they have bad breath. What causes it?
Okay, thank you. Bad breath entails a lot of things. One, you have to brush your tongue very, very well. You have to brush your tongue well. And also, is the food that you eat. Something like garlic give a lot of bad breath. Some of the food give a lot of bad breath, especially where we come from. We know the food that we eat. And even not putting it in your stomach, you know, some of them, they really stink. And after eating it, don't go there. So the food you eat can also contribute to bad breath. The food you eat can also contribute to bad breath. So yeah, but there are things to do to help. Things to do to help it. Let's say temporary in the position, using a sugar-free gum, and using specific mouthwash for bad breath. Specific mouthwash. Over here in the UK, we've got specific ones for bad breath that you can use, which is good for you. And also, sometimes there are bacteria who causes bad breath. Sometimes also it's some disease in the head that will cause a bad breath. So whenever you have a bad breath and you can get to a dentist, please go to the dentist for them to investigate further, because sometimes they can investigate and take you, maybe over here, we will refer you to the hospital. They will investigate, and if nothing is found, then we can just advise you to use a mouthwash, brush twice a day, and use a bad breath mouthwash. Bad breath is called halitosis, and to prevent that, brush your tongue very well and use sugar-free chewing gum, sometimes in between. That will help it temporary. And also, yeah, get a dentist to investigate further, because every case is different. So I cannot judge 100% on that particular incident, but there are different cases that is, some of them is a serious one that we have to investigate the head. Some of them come from the head that we have to investigate. Some of them come from the stomach. The stomach one can be the food you eat. So it's different types, and the basic things you can use. Get a bad breath mouthwash and use sugar-free chewing gum. Thank you.
Thank you very much. So once again, we welcome you, Sister Ekria Ejewa. Thank you for joining, Brother Edwin. Thank you for joining, Brother Oladejo Abiodun, Sister Cecilia. Thank you all for staying tuned. So we continue with questions from our viewers. This sister, once again, Sister Stephanie. Sister Stephanie says, please, I've lost part of my upper right premolar tooth, and even now, I'm unable to eat with that side. The entire space is swollen and very painful. Please, what should I do?
Our sister should see the dentist, as she is describing. She's got a serious tooth problem. So if you have lost teeth And some of them, it depends which part of the world that you are. You might need a tooth replacement, which can be done in any part of the world. Even in Ghana, I spoke to one dentist. They do every treatment that we do in the UK here. They do implants, they do dentures, they do everything. So please, wherever you are in the part of the world, see a dentist. The part that you have lost a tooth, when you lose a tooth, it's not the end of the world. You can always find a replacement of that tooth, so you'll be able to eat your food well and enjoy it. So please go to the dentist. They will help you with replacement, and if there is any further problems, they will be able to assist you. Thank you.
Okay, so in this case, what if she has seen a dentist and the problem still persists?
In most cases, when you see a dentist, this is a basic case. It's not that serious. It can resolve easily. So in most cases, we will actually, we have something that we call a treatment plan. That when someone comes to the dentist, we plan your mouth, we plan what we're going to do for you. So with the missing ones, we will think with you, with the patient, of how to replace it. And luckily, we've got choices. We've got the removable one, which we know with our grandfathers and our daddy, that is called dentures, that you remove at night and put in the cap. That is the basic one. And now there is a permanent solutions as well. We've got bridges. That bridge you can put in between to replace 2, 3 teeth or even more. And we've got permanent one, which is called an implant, which is the closest one to teeth that you cannot even tell. It's called implant, that you can have to replace any missing tooth. So if you go to any dentist, they will be able to help you in any part of the world that you are in. And even if you are still having pain, and I think there is so much going on in that case that you said, because he said, I'm still having pain, I'm still in pain. That means maybe there is a gum problem going on. Sometimes when gum problem is going on plus tooth decay or tooth problem as well, it makes it very difficult. So the patient have to be examined, x-rays have to be taken. You can't take the words for it. You have to take x-rays and investigate the case properly. Thank you.
Thank you very much. So your advice is to Sister Stephanie to see the dentist, and then if possible, there is a replacement for her lost tooth.
Yes.
Now, Sister Ekuya said, my name is Ekuya from Kumasi. Welcome, Sister Ekuya from Kumasi. Said, please, how do we determine the type of toothbrush for us? How do we determine the type of toothbrush?
Okay. Toothbrush, at the moment, we've got the manual toothbrush and we've got electric toothbrush. So in basic terms, now we advise people to go for the electric one because it cleans better. And with the manual one also, the technique to brush well is difficult for some. So with the electric one, they do all the job for you. All you have to do is place the head of the toothbrush on your teeth, and you just press the on button and it will start vibrating, and you just go round on the top arch, inside it, outside it, and at the bottom arch, inside, outside, all sector. You brush the inside, the biting surface, and you brush the inside as well. So the outside, the inside, the biting surface, and everywhere. And you brush the tongue as well. So I would say go for the electric one. But for myself, I use both manual and electric because sometimes the electric, your battery must go low and you just need to brush. So I've got both at hand. So if possible, get both at hand and then use them. You can use them alternate. In the morning, you can just use the electric, and in the evening, you can use the manual. Or when you start using the electric, you will fall in love with it. I started using electric. At first, I didn't know how to use it. So I wasn't really interested in it. But it got to a time I'm like, let me visit this once more. So I tried using it again and again, and I started falling in love with it because My teeth even became whiter. My teeth even became whiter as I used the electric one. So electric toothbrush are really good. Thank you.
I'm sure she asked because with toothbrush there's a hard one. The brush itself. We have the hard, we have the soft, and we have the medium. So I'm sure she was asking basically about the manual one, which type to be used.
Okay, the manual one, the type. Don't go for a hard one. As we said earlier, brushing hard doesn't mean you are brushing well. The best one to have is the medium one. Go for the medium one and brush well. Brush well with the medium one. But the hard one will destroy your teeth, because when you use the hard one, as I showed earlier, the harder part of the teeth is the enamel. And as you grow, the harder one, we abuse our teeth so much in life. All the food we eat, everything, we abuse it. So when you use the brush one, you are brushing away the enamel. And over time, it will be sensitive because you will brush away the enamel and it will start to get into the dentine, which is the sensitive part of the teeth. So don't use a hard toothbrush. It will harm your teeth.
Thank you very much. So, Sister Ekria, she said again, please. No, she asked this one. Sister Patricia said too much of acid in the mouth is dangerous and it can cause bleeding in the mouth. Yes, you are right, Sister Patricia. Sister Ekria once again said, please, if I'm to brush my, he said, because if I'm to brush my gum when brushing, teeth, then it means the type of brush also counts. Yes, you are right, my sister. And then this one said, good morning from Accra, Ghana. Good morning to you, Sister Cecilia. And Sister Grace said, is it true that a woman who vomits during labor will eventually lose her teeth as she ages?
No. Obviously, vomit itself contains acid. But when you vomit during labor, no, you won't lose your teeth. We as women, we put everything on our children. Some people come to the surgery, they say, after I had my children, I lost all my teeth. After I had my children, obviously during pregnancy, the baby take your nutrients to build the baby self up. So the baby will take a lot of nutrients from your storehouse, from whatever that you have. So after having a child, you have to boost your calcium level, and you have to boost your vitamin D level as well after having a child, even not if during pregnancy, because over here in the UK now we advise pregnant women to take vitamin D as in pregnancy to help them, because the baby will be taking your stored ones. So it's not the vomiting during labor that will cause you to lose your teeth. It's never true. Thank you.
Okay, so Sister Grace, it's not the vomiting, but it is up to you to increase your calcium level. Okay, so Sister Cecilia said, Sister Beatrice, this is a very good program. God bless you too, my sister. This one said, may the Lord Almighty increase your intelligence and more grace and blessing for your program in Jesus' name. Amen.
Amen.
This one said, thank you so much. My son is 16 years and he has a hole in his lower teeth. He doesn't sleep at night. Should we remove the tooth? I'm very worried because the tooth is still strong and you can remove cause of it. Can it cause death? I think she's asking that way, that her son is 16 years.
No, that cannot cause death.
Okay. So is it advisable to remove it?
I think the dentist will take X-ray. When this boy see the dentist, they will take X-ray and then they will decide the case, because some of the cases, it hasn't gone deeper. It's just on the enamel. Maybe it hasn't even reached the dentine. Maybe it haven't reached the palp. So it depends how deep that tooth decay is, how deep that hole is. So they have to go to the dentist and they will take X-ray. And if it's possible, if you haven't gone deep, then they can just fill it. It's easily to do. And even in some cases, you can do what we call root canal, not necessarily because this boy is so young and you can't be removing the teeth at 16. No, you have to keep your teeth as long as you can. So there is treatment that they can do if it hasn't gone too far and too deep. Even if it's gone too far, there is something we do that's called root canal treatment, that we will go and clean inside the tooth, get into the roots, remove every bad thing, replace it with filling, and even in the end, we can crown the whole tooth, put a cap on it to cover, to protect it. So there is so much treatment to do. He is young, he doesn't need to remove his teeth. Thank you.
Thank you very much once again. So this brother Edwin, he said he removed 3 of his teeth. Toothache is very bad, and he couldn't do anything. He said at age 43, I'm age 43, but I fear all my teeth gonna come out. Cause I was 15, I got one out, and then be experiencing jaw pain and swollen gum. So such a person, what advice do you have for him? He has been removing his teeth, and he said now he doesn't know how to manage it.
Okay. I think our brother really need help from the dentist. And also the advice I would give is our brother should follow all the protocols of dental health care, like brushing twice a day and using a fluoride toothpaste, cleaning in between the tooth, brushing well, brushing the tooth as well as the gums. And also having a mouth rinse after meal. Because if you've gone through things like this, some people even brush after eating. After every meal, they brush. But not to abuse the enamel too much, use a mouthwash after eating. And make sure your mouth is always clean. And also, he should watch his sugar intake. Sometimes it's even good to list out the things you eat down. And at the end of the week, you calculate how much sugar you have consumed, because you eat so much sugar you don't even realize, and which is bad for you. So he has to check his sugar intake, his acid intake. Is he someone who drinks fizzy drinks? Is he someone who have a lot of citric fruits? What is his diet like? So he has to watch his diet and brush properly, and also consult a dental care professional. Thank you. Thank you.
That's a question for us. He said, please, is it good to use tooth whitening products? Is it good to use tooth whitening products?
Okay, thank you. Tooth whitening is good to use them, but on the internet, there is so much going on, and we've got how much. There is something called 1 minute, the carbamide peroxide that is in tooth whitening that bleaches the tooth. And using something that bleaches the tooth have to be used carefully, because there are percentages that is good for your teeth, and there are some percentages that can bend your gums. So you have to be careful what you buy from the internet. You have to know the percentage, whether it's good for the teeth or not. So it depends which type. But in general, if it's less percentage, that is good for you. Thank you. But it can also cause sensitivity. It can cause sensitivity. Tooth whitening can cause sensitivity. So when you are using tooth whitening, please use sensitive toothpaste. Sensitive toothpaste. You can use sensitive toothpaste whilst whitening your teeth. Thank you.
So this brother said, Brian Lee, he said, my grandma has serious tooth problem. It looks like it's removing, but it's breaking bit by bit, becoming green in color. Anytime she touches, blood comes out. The gums feel so soft and swollen. Looks like some kind of fluid has filled it. I don't understand this. But I think he's complaining about his grandma's teeth. So, what's your advice? He said it looks like it's removing bit by bit and becoming green color.
Yeah. With the grandma, at the moment, I think it's combination of tooth problem and gum problem as well. So in this case, sometimes there is a lot of things going on in the mouth that need addressing. And I will say, being a grandma, the good thing the grandma can use is warm, salty water for now. Warm, salty water is really good for the gums. When your gum is swollen, just use warm, not hot, warm, salty water, and use it to rinse the gum as many times as she can, and then see a dentist. Thank you.
Thank you very much. So, let me ask this question. Because we were talking about sugar and toothache. So I was worried. Does it have a link with diabetes?
Yeah. Tooth problems have a link with diabetes, and diabetes is more the gums. So over here in the UK, as soon as someone is diabetic, they get free dental care as well. So that they encourage them to be visiting the dentist regularly, because as diabetes is, and with sugar and the insulin and everything, your teeth get affected as well. So if the person is a diabetic, they have to see their dentist regular. Thank you.
Thank you very much. So this one said, wow, cleanliness is next to godliness. May the Lord bless you with more wisdom, Madam Jennifer. Thank you very much, my brother. This one said, how long can tooth replace last? Because I want to replace my tooth.
Okay. In the health sector, there are no guarantees. There are no guarantees in health sector, because everything can fail in health. So you can, some people, I've seen patients who have got tooth replacement for like 40 years. They've had it in their mouth for 40 years. But it's different from person to person. And is different as our bodies are different. Everything about our bodies are different. So I cannot give you a date or time on it, but it can last you a lifetime. Some of them can last you a lifetime. Thank you.
Thank you very much. Brother Eric said, good day, ladies. Good day, Brother Eric. So this one said, when I wake up every morning, I experience jaw and neck pain. It takes about 6 days. So
that could be a serious thing or nothing to worry about. So I will get the person to go and see a dental care professional, because when someone comes to the dentist, we check the jaw and the neck as well as the teeth. We check the whole head as a whole. So getting a jaw pain, something might be going on or maybe not. So please get it checked. Thank you.
Thank you. Mr. Stephanie once again, he said, please, is it good to use gold tooth in case you want to replace? Is it good to use a gold tooth?
Thank you. Normally, it's for aesthetic that you use gold teeth. Is for just your fanciness and for aesthetic reason. So it's up to you. It's up to you, but it depends from person to person and what you like and what will make you happy. So it's up to the person. Thank you.
Okay. And this brother someone said, keep it up. It's really educative. Thank you very much, all of you, for your questions and comments. So before we wrap up, because we have about 5 minutes to go, before we wrap up, I want you to tell us, like in general, what must be done to take good care of our teeth. What should we do in general?
Okay, thank you. What we can do in general is, if we shouldn't be a smoker. If the person smokes, the person should quit smoking. And alcohol consumption as well have to be in a moderation if the person drinks, because they all contribute to a dental care problems. And also visit your dentist regularly. And use interdental brushes to clean in between your teeth, and also floss in between your teeth. So you can use either brushes to clean in between your teeth, or either any of them, either floss or interdental brush. And also brush twice a day. And as I said earlier, use the mouthwash after eating. Rinse your mouth, and then you will see how much food particles that will come out of your mouth. And also use a medium toothbrush to brush your teeth. And look after your mouth really well, because your teeth supposed to last you a lifetime. Your sugar intake, acid intake, and fizzy drinks in a moderation. Everything in a moderation, even things that are good for you in a moderation. And brushing twice a day. Make sure last thing before you go to bed, you brush. I think the night brushing is even more important than the morning one, because at night your mouth is closed and there is no activities going on at all. During the day, your mouth is constantly have saliva. So the saliva help to wash away every activity that is going on in your mouth. But if you don't brush at night, when you sleep, the saliva, everything ceases as you sleep. So the night brushing is very important. Brush twice a day, floss in between your teeth, use mouthwash different time from brushing, and stay away from too much sugar, and that will help your dental health. Thank you.
Thank you very much. So your final words for us, is there any link between oral health and general health? What is the link and what is your advice for us?
Okay. With oral health and dental health and general health, if your health is poorly, it affects your mouth as well. If your vitamins level and everything that is going on, your calcium level, your vitamin D level, it affects the mouth as well. So look after yourself very well. Make sure you take some vitamins and seek advice from the chemist before you take them. Don't self-medicate and everything, seek advice. And in general, if you are somewhere and you have a toothache and you don't know what to do, just use warm salty water. Use warm salty water to rinse your mouth. That will ease the pain a bit. Thank you.
Thank you very much. So our viewers, thank you very much for joining and doing the listening. Madam Jennifer, please, any shout out to your friends and family?
Oh, okay. Thank you so much for having me on your show. And I would like to say thank you to you, first of all, and all your hosts, the people in the studio. God bless you so much. I would like to thank the Almighty God for this privilege as well. I would like to thank my husband, Mr. Jeffrey Owusu-Ansah, who has been a backbone to everything that I'm doing. And I would like to thank everyone on Freedom Prayer House. That is my ministry. I would like to thank everyone on that platform. And also my sister, Aku Bless, I would like to thank her. I thank everyone in the whole world. I love everyone on your platform as well. God bless them and keep them. Thank you. I think we will do this again, and there is so much to talk about. So God bless you all. God bless you.
Before you go, I think we should host you next week also, because I think we need to look at the specific, like the types of the tooth problems and the causes.
Okay. Because today was just the foundation, so we will go deeper. Yeah. Thank you.
Can we have you next week also, so that we'll go deeper?
Yeah, it's fine. I'm always there and I'm available. Always glad to help. Thank you.
All right. We are most grateful to you for joining us today. Thank you very much, Pastor Mrs. Jennifer Owusu-Ansah. God richly bless you and bless your ministry. And then we thank you all, our viewers. Thank you, our listeners, for your comments, your contributions. So in all, or to sum it up, your dental health and your oral health is very essential. It's an essential part of your overall well-being, because it is linked to your general health. So, like our pastor Mrs. said, you must make sure that you brush twice daily, you floss in between, and then you use your mouthwash immediately after eating, not after brushing. And also seek dental advice in case you are experiencing any health issue or any dental issue. Don't stay at home to medicate. And if you want to medicate at all, the best or the least thing you can do is to use a warm, salty water to wash in between. So once again, we thank you all very much for joining and doing the listening and also commenting. We will catch you live next week, same time, like this, 12 in the afternoon or 12 p.m. Kuwait time, 9 a.m. Ghana time, 10 a.m. UK time, and then the others. All right. So thank you all for joining. You can follow us on Fulltimebuzz Media. We are on Facebook, we are on YouTube, we are on Instagram, we are also on Twitter. So you can follow us on any of our medias and then you will get us. Please don't forget to like our programs. Don't forget to share. Don't forget to comment also. And then tell a friend to tell a friend to tell another friend about Fulltimebuzz Media. My name has been Beatrice, and I'm glad you stayed. Catch you next week.
Here we